Hello, I'm Dr. Rakhi, specialist orthodontist with 32 Smiles. Firstly, congratulations for starting your Invisalign journey. Today, I'll be giving some instructions which you have to follow post-bonding of Invisalign. First and foremost, a patient has to wear their aligners for 14 days and for 22 hours per day. They are not supposed to drink or eat anything with the aligners on except for the water. No beverages, tea, coffee, nothing. Just plain water they can have when the Invisalign is there in their mouth. As far as storage is concerned, a patient has to keep the Invisalign in the box which is provided by the Invisalign. Never wrap your Invisalign in any tissue, any paper or any kind of thing. We will tend to throw it off. And other part is when the set is done. Let's say you have worn your first set and for 14 days. On 14th day, you have to keep your set in the respective pouches. Do not misplace or throw your aligners until your treatment is complete. How you have to wear your aligners? One, instructions will be given on the table side, on the chair side to you, and also if you do not understand. So you have to first take your aligner and you have to match your midlines, center of the aligner to the center of your teeth. Push it like this. Go to the back teeth, you have to push it here and you have to push it here. This is how your aligner will be seated. And the proper seating of aligner, you have to use something called chewy, which will be given to every patient. So this chewy you have to use in the beginning of every set. So let's say you are on the set first and you have to chew on chewy everywhere. Everywhere you have to chew for 5 minutes a day, and that you have to do for 2-3 days. And every time you change the set, make sure you are chewing on chewy. This ensures the proper seating of aligner and aligner works the best. And if a patient is not comfortable removing their aligners with their hands, we also provide this aligner remover. So what you have to do is, you have to engage your aligners in the last teeth and you just have to elevate it. So it elevates. Do it from both the sides and your aligner will be out. So this also helps. When you start your journey with the aligner, there will be few problems which you will face, like slurring of speech, little bit pain, and that is totally fine. Everything is good after 4-5 days or 6-7 days of wearing aligners. So this happens, the tightness, the pain you will feel every time you change your sets. As far as cleaning of the aligner is concerned, you have to clean your aligner with the plain water and toothbrush. Every morning when you are brushing your teeth with the same brush, you can clean the insides of your aligners. Little bit of staining will be there, which is not a concern as we eat a lot of stained food. But with aligners, we don't have to chew on anything. We have placed certain attachments on the teeth which might come out sometimes. So this is not an emergency situation. There might be times when the buttons and the attachments you might ingest it. So do not panic. So whenever you are walking next in the clinic, we can always fix that. So it is not an emergency or a panic situation. We also have an app called My Invisalign. We set it and give it to you. On 14th day, when you have to change your aligner, change it in the night during your sleeping time, like 9 p.m, 10 p.m. or 11 p.m, whichever time you prefer. Go to the second aligner or whichever aligner you are changing, go to that in the night. After the completion of your aligner sets, there comes retainers. Do not discontinue wearing your aligners until and unless it is advised by your orthodontist.